So this is obviously a very complicated case. So Dr. Williams, I know we've both received patients like this in the past. How do you incorporate all of this information in a case like this?
Well, it's definitely a challenge because not only has the case been open already for 3 months with significant care up until that point, the patient suffered a significant physical and emotional issue to begin with, and then things have unfortunately deteriorated since that time. So you're right, there would have been a lot to try to bring together in that first visit. So before I accept a transfer, I'm always able to read the medical records, which are sometimes incomplete, but it usually gives me a pretty good sense of what's happened to that point. And so what I try to do is make sure that we set aside adequate time for that initial visit with the transfer patient so that I'm able to not only discuss with them the care that they've had, but to give them a chance to tell me their story from the beginning. And so I always try to thoroughly review, how did the injury occur in the first place, take me through the events that led up to the injury, the immediate aftermath, and then where the care has gone from there. Beyond that, I also will often reach out to the providers who have participated in the case to that point to try to get a sense of what's been done, what's worked and what hasn't. And I think, as you know, anytime someone's transferring care, that typically means things have not gone well. And that's either because there has been a direct conflict between the patient and the provider, or the patient just hasn't gotten better and has decided that they need to seek care from someone else.
So there's a lot of information to share with a patient like this. How do you approach some of those discussions? Are there any resources or tools that you use to discuss, at this point, what is chronic pain?
Right. Yeah, I think that what I try to do at that initial visit is go through what I think perhaps should have been done at the initial visit when they were first injured. So I try to give the patient a reset, and I start with some information that I think is helpful to them. I explain how the work comp system works and what the confines are. I talk to them often, particularly in a chronic pain case or a case that's already several months old like this one, to say what we're able to do for you is based in evidence, but it's conveniently found in the Colorado Medical Treatment Guidelines. And the reason I think that's important is because it gives me an opportunity to explain to the patient that they have a lot of care at their disposal, but not unlimited care and not anything that they may be able to find on the internet. The other thing I think is important is I define for them what maximum medical improvement means, because even though that's a term that many injured workers hear, they don't really know what that's supposed to mean to them. And so I believe that many people think maximum medical improvement means I'm completely recovered from my injury, and we both know that's not the case. So I think it's important that they understand that we say that means in an ideal setting, you're completely better, but often it means as good as you're going to get, assuming standard of care. And so the typical example I use is that if someone cuts off their finger at work, they're never going to be 100%, but at some point they are going to be as good as they're going to get. And I think if you use that simple example or something like that to say, of course we want you to be completely better, but that might not be possible in this case. So I never want to set people up to fail. I never want people to not try as hard as they can to get completely better. But I think setting those goals initially are extremely important.